everyone, thanking you for joining us today. I know it's a very busy period as everyone's trying to get things done before the holidays, so we really appreciate you taking your time to share your experiences and learn from colleagues during this session. So this is the second EPE session that is being organized by the COVID-19 Working Group. Thank you to everyone who participated and presented during the first session, which was about how we adapted the way that we conduct evaluations and evaluative exercises, considering the constraints and opportunities presented by the COVID-19 pandemic. So this second session is on our actual evaluations of COVID-19 response. And I know that that's really been the sort of main work that many of us have been involved in over the past year and a half, both in our individual agencies and as part of joint exercises. So we thought this would be a good opportunity to hear from some colleagues on their experiences of evaluating COVID-19 and to share some lessons that may be helpful or applicable to your own situation. So we are going to do it a little bit differently than a standard EPE session. We don't actually have any PowerPoint presentations to share with you today. So we wanted it to be more of a discussion. We're doing it in a panel format. And we have 5 colleagues who will be joining us. First, I just wanted to introduce Jane Wangi, who is the chief of our humanitarian section here in the UNICEF Evaluation Office. She's going to be moderating the panel. I'm Mona Fatou from the UNICEF Evaluation Office, and I'll be overall facilitating this session. And Carlotta, also from our office, will be monitoring the chat and helping with the Q&A. And then our panelists, we have Peter Wichman from ILO, Richard Jones from UNDP, Esther Kagwa from the UNICEF South Asia Office, Leslie Thomas from UNRWA, and Deborah McWhinney from WFP. And they'll each have a chance to introduce themselves and their projects in a moment. So in the before we kind of jump in, I thought we could get a little bit of a pulse check in terms of what participants have been doing in their own agencies regarding COVID-19 evaluation. So I'm going to turn it over to Carlotta, who is monitoring the Mentimeter. So over to you, Carlotta.
Thank you, Mona. Hello, everyone. Let me share my screen. I'm going to quickly go through the responses that you gave to the quick Mentimeter poll that we've created. Okay, hold on. Sorry. Okay. Can you see the graph, the first bar chart? So the first question that we asked was, on which of the following aspects of the COVID-19 response did your agency's evaluative exercises focus on? Interestingly, I mean, you'll see it's a bit of a mixed bag of options here, but just to give a bit of a flavor of what the evaluative exercises around COVID have focused on. Programmatic adaptation and organizational arrangements seem to have the largest share of responses. In terms of themes: socioeconomic, followed by health and nutrition. Very few on support to vaccine rollout, and yeah, too little probably on accountability to affected populations. Moving on to the second question around methods and tools that your agency used to evaluate the response to COVID. Again, a mixed bag of options, but just to give you the gist. A lot of synthesis work and desk reviews, of course, quali methods, little in-person data collection, understandably because of the lockdowns and the restrictions related to the pandemic. some interviews and focus group discussions with affected communities. I find that interesting, and also a little bit of innovation for data collection and analysis as well. Third and last question was around agencies' plans to conduct evaluations of their response to COVID in the next 6 months. And despite the wealth of information that is out there already when it comes to response to COVID, it seems like there are agencies that are still planning on conducting evaluations on this topic in the next 6 months or so. So yeah, this is a bit of a flavor, an icebreaker before we start. Over to you, Mona.
Thanks, Carlotta. No, that was really interesting. And I think a lot of these themes and questions are going to be coming up in our discussion. So that was really helpful to help frame it. So just to let you all know a bit about the format, as I had alluded to earlier, I'm going to hand it over to our panelists who will each give a brief introduction of a few minutes of the projects that they're going to be discussing today. And then I'll be turning it over to Jane, who will be moderating a panel discussion, asking some questions of them and their experiences. And we'll also be opening it up to a Q&A to all participants, and we're expecting a really rich and interesting discussion. So we do encourage you to come up with questions. Also, please send any questions in the chat box at any point during the session. So I think we can jump right in. I will start off with Peter, who will talk about ILO's evaluation framework for evaluation of COVID response, and then the resulting protocol synthesis and evaluation that they had conducted or are in the midst of conducting. So over to you, Peter. Thank you.
Thank you. Thank you, Mona. And good afternoon, morning, evening to everyone. And thank you for the opportunity to participate in this session to share our experiences. We're all in various ways and with various challenges looking at how to evaluate the response to the pandemic, and it's something that keeps us all occupied. So good to have this chance. What we saw in ILO was, of course, that it's important to set up the enabling conditions for the evaluation of the response. We are following a coherent approach to the evaluation of COVID-19 that we have been developing and that is evolving in line with ILO's response to the response or ILO's response to the COVID. This reflects that the response to the COVID-19 pandemic, particularly long term, must be integral to ILO's normal areas of work to ensure medium and long term sustainability and impact. The ILO, as such, early on developed four key policy framework with four key pillars in mid 2020. That was based on a series of policy briefs to tackle response. There was then a formal policy decision and document by the International Labour Conference in mid 2020 that has had a call for action to constituents and partners. And these frameworks for the response also, of course, linked to the various UN frameworks. ILO also revised some of its indicators in its results framework to reflect specifically COVID-19 action. We also, in the evaluation unit, as part of sort of internal learning and real-time input, actually looked at past evaluations that would, looked at crisis situations in the past, such as the financial crisis of 2008, to see if we could come up with any evaluative lessons that we could feed in there. Then the actual evaluative framework that we are now implementing was, first of all, presented to our governing body and discussed in various ways or agreed on. And then we also early on had the guidelines on sort of the implications of the COVID-19 on the evaluations, and that was sort of the topic of the first session of this EPA. But the point of that was to ensure that as much evaluation as possible, given the circumstances, continued. So we would continue to actually generate evaluative experience. Then we developed a protocol that was specifically geared towards saying, when you do these evaluations, what are the things that you can incorporate in the evaluations in terms of evaluation questions and approaches to ensure that we did actually generate evaluative evidence specifically looking at the COVID-19 response that we could then use in going forward. We then carried out a synthesis review in 2 phases, and this was a synthesis review that looked at evaluations, both those of projects that have been repurposed for COVID-19, but also others, to see where there were the lessons learned on the evaluative on the response to COVID-19. And we needed to do it in 2 phases. One was the initial set of evaluations that were done, mainly of slightly repurposed projects, and then second set of evaluations where we could see more explicit response and specifically designed response to the COVID-19. We are now doing the 2-stage approach to the actual high-level corporate evaluation, where we have an initial stage of scoping, very detailed scoping, and we find that that is very important. That is trying to come up with an initial evaluation framework and theory of change based on these ILO's policy documents and what we know from the synthesis review, and then followed with a second phase that is, if you like, a full component based evaluation with all the dimensions, with case studies of countries and thematic areas of work, with a team of evaluation experts that both have the evaluation experience, but also has particularly experience in evaluating the various pillars, the various areas that we are looking at: social protection, employment policies, and so on. And the evaluation will have, and that's sort of the final point, it has 2 key dimensions or areas of analysis: the institutional readiness and capacity to deliver, to design and develop timely support, and then ILO's policy action in support of our constituents at the national, regional, and global level. The report will be finished by mid-22. It will be submitted to the governing body in the 3rd quarter, and that's very important for, of course, for the use and the follow-up, because again, COVID-19 response is part of everything that ILO is doing. Thank you. I hope I have stayed within my 5 minutes that I was allocated, and I'm very happy to be participating in this and take further questions and be part of that discussion. Thank you.
Excellent. Thank you so much, Peter. Yes, you've just come in over the time, so appreciate that. I think just to keep things moving along, we'll move right on to our next panelist, who's Richard from UNDP. So go ahead, Richard. Thank you.
Thank you. Good morning. It's good to see you all. So yeah, we followed actually a similar approach to ILO. We initially in 2020, we issued guidelines for decentralized evaluations. Normally UNDP produces around 300 decentralized evaluations. They're not managed by our office, but our office then does around 20 ICPEs and 2 or 3 thematic evaluations. So in 2020, we issued guidance to try and keep some continuity of implementation of evaluations going. And by January, it was of 2021, it was very clear that actually, surprisingly, if you like, evaluation had continued. And during the year, we saw around 250 evaluations done. About 150 of those were done after June. So we decided, or I decided, following a series of papers last year, we did a set of synthesis papers on crisis response across different areas, that maybe there was an opportunity here to look at those 250 evaluations and capture some of the trends and results from 2020 to see what we could learn about the pandemic. So about 150 of them included COVID-19 related elements. And as you can imagine, it was a bit of a sliding scale. So from June through to September, it was about how difficult it was to do evaluations under these constraints. But then from about September onwards, you were starting to get these snippets of lessons coming through about the response of different programs. And it just as Peter said, about how programs pivoted and adapted and how they were constrained in their implementation. So the idea was that we'd do something quick, 6 weeks to 2 months, get it out, started in February, get it out at the end of March, and try to then use that piece to inform the broader discussion around COVID-19 and implementation, but also for our own planning for the COVID-19 evaluation. Okay, planning is one thing. By the time we got to April, we realized it wasn't quick and dirty. And by the time we got to April, we realized there was another 100 evaluations, which had a much richer source of information in there. So we continued. The paper was issued in June, launched in June, when we finally had a cutoff. And, we had a very interesting set of findings that came out of that around adaptation, procurement, digital development, challenges to projects that weren't able to pivot, so lack of flexibility within programs, the impact of the pandemic on future implementation, what happens when you have funding taken away from a program when it still has 2 years to go, so there was some fascinating elements coming through, but all of that was condensed into 4-5 pages as a quick synthesis and reflection. However, it did provide us with the basis of a lot of knowledge going into our country program evaluations in 2021. It provided a baseline and a lens for our evaluators within the office to start to look at some of the programmatic aspects at country level. And each of our country program evaluations, 15 this year, have a specific section on COVID-19 responses. So that, and again, is the next step, which will aid us to draw, again, maybe a synthesis, or it will lead in evidence that's leading into a current evaluation, which is about to be finalized, which is a formative evaluation looking at UNDP's positioning and response. Thank you. Positioning, response, and adaptability in the face of SDG regression and the lack of SDG financing. So we're looking at the tools UNDP has and the planning tools, and those lessons that came from the synthesis and also the ICPEs have proved invaluable into that broader sort of formative evaluation that's focusing on how UNDP might need to change a certain set of tools to adapt to the new reality of COVID-19 and SDG regression. Sorry. Thank you, Mona. Thank you, colleagues.
Thank you, Richard. I think that's a really important topic, as many SDGs are off target already, and looking at how COVID has accelerated that and how to overcome it. So that's great to hear that that's planned. So I want to turn it over now to Esther. She's going to give a regional perspective from, she's coming in from Kathmandu, and we'll be talking about the real-time assessment in her region. So over to you, Esther. Thank you.
Thanks, Mona. In terms of the assessment we did a real-time assessment of the COVID-19 response, of the UNICEF COVID-19 response in the South Asia region. And this was done in 7 countries. We have 8 countries in South Asia, so all the 7, with the exception of India, which had its own already full-fledged evaluation going on. We started this evaluation last year, actually, 2020, between September and December. And so UNICEF had all these, most of our countries had worked with governments on COVID-19 response plans. And so the evaluation office at UNICEF also had a template with tools and guidelines and a concept note that we were encouraged to adopt. So that's the one we used. And we looked at a number of things. One, we looked at how the needs for the response were determined, if those needs were in line with the actual needs on the ground. We also looked at how countries were adapting their programming to respond to the pandemic, and then also looked at the quality of the response. So quality in terms of involving stakeholders, quality in terms of timely delivery of services, quality in terms of monitoring, how was the response monitored. And then we also looked at challenges and lessons learned. We used a number of data methodologies. We actually had interviews, key informant interviews that were done virtually. We did a desk review and also had a perception survey. And the evaluation had a number of respondents, government officials. We also looked at interviewed implementing partners. We interviewed frontline workers. So in some cases, it was teachers, healthcare workers, and also tried to reach beneficiaries, which was a kind of really challenging. So when we were not able to reach beneficiaries, we looked at and interviewed representatives of beneficiaries. So that was the real-time assessment. A report was provided to each country, each of the 7 country offices, and then we also disseminated at the regional level. As a basis of that evaluation, our country offices actually tailored their plan and their ongoing COVID response plans based on that. So that is what we did in South Asia, and looking forward to discussing more of this.
Excellent. Thank you so much, Esther. I will turn it over now to Leslie to talk about the work in UNRWA. So over to you, Leslie.
Thanks so much, Mona. So just contextually, UNRWA is in a direct service delivery work. We educate about 500, more than 500,000 children. We have over 20,000 staff who teach. And we also have 140 health clinics. So we are very much a direct service delivery agency providing services to Palestine refugees. And lockdowns throughout our region in the Middle East started happening around middle March. And immediately following that, as we were all starting to work from home, Evaluation was contacted by the field of operation in Jordan and asked to implement on sort of a real-time evaluation, observing and talking to staff up and down the organizational hierarchy to understand how the agency was adapting, what was happening in the moment, what was slowing action, what was challenging staff, and then also trying to capture innovations and what was working well, because there was an overall feeling that people were quick to respond, people were taking action, that decision making was being decentralized and that good things were happening. But when you have 30,000 staff and most of them don't have a laptop, you also will have things that slow the process. So this was about trying to inform understanding of how things were working in the moment and to quickly produce results. So we developed a terms of reference in the first week of April. I mean, this is right when things are just kind of happening. We conducted research for the first field of operation over a 2-week period starting in the middle of April, and by a few days after that, we produced our first report. So we were turning around the research and the reporting within about a 3-week cycle through this first experience. And we did about 40 interviews, and we observed daily meetings that brought together the field management team in making decisions, talking about issues, and how they were going to respond to that. So following that, following this first round, which basically took place in the month of April, we shifted to the West Bank field of operations and looked at what happened there. The interesting thing so as we were doing this, we were kind of adapting our process for the real-time evaluation in the moment. And I got some resources from the Office of Internal Oversight with the Secretariat. They lent us, because they were adapting what they were doing, they lent us 2 evaluators to help us in conducting interviews. So it really broadened the number of people that we could talk to. And so we focused on health, education. We did interviews over basically a 2-week cycle, and then we would produce these rapid reports that reflected on, what was working well and what wasn't. And I think we also held briefings with the field management team so that there was an expression of here's what we've learned, here's what needs to be done, here's what monitoring needs to be improved, and what we need to be doing to ensure understanding about the beneficiary experience. So it was all very fluid and happening very rapidly. So at the end of the day, we completed 3 of these. We focused on Jordan, West Bank, and Gaza, and produced these quick reports. And I think that it was very appreciated. It helped sort of capture information in the moment and help support learning across the fields, because people were so focused on their field work that these reports actually helped create understanding across the agency about what other fields were doing to adapt. So those products actually influenced what people were doing across the fields of operation. So with that, I think I will stop. Thank you.
Thanks so much, Leslie. And I want to turn it over to our final discussant, who is Deborah from WFP. So over to you, Deborah.
Thanks, Mona. A little tough to come after so many interesting presentations, but and I was picking up areas of commonality and differences as I was listening to my colleagues, and so I've added a few things, in fact, to what I had planned to say, which was really to focus on one evaluation. In addition to what I'll say about that, I just wanted to maybe start by saying that we have, similarly to, I think, what colleagues, both Peter and Richard, were mentioning around providing guidance and/or sort of technical notes to colleagues in the field, produced a technical note on planning and conducting evaluations during COVID. That was one of our first sort of products to get out to help colleagues. We had a gatekeeper function enabled in WFP, which was something that was managed or initiated centrally by management, by senior management, and it meant that there was the role of the directors, the regional directors could sort of say yes or no to an HQ request to the field. Now, evaluation and audit were sort of exempted from that, but we did have to manage that balance of letting the field get on and deliver, because they were massively involved, as you can imagine, in delivering, as were all of our agencies, I presume. So that happened, and we were also integrating COVID-related questions into country strategic plan evaluation terms of reference, into strategic evaluations that were ongoing, that sort of got embedded. So that evidence is coming through those evaluations now that have come to fruition all throughout 2021. So that's just a bit of a backdrop to the broader evaluation work, and there's of course decentralized evaluations as well. I'm not going to go into that. What I wanted to speak about today was in fact our corporate emergency response evaluation. So we at WFP, we have a mandate to evaluate all corporate emergency responses. And we wanted to do this while, of course, the response was still ongoing. Some might argue that it's still ongoing even now, but certainly, mid last year, we didn't get started as quickly as you, Leslie, in April, but by May, June, we were certainly talking to senior leaders and trying to understand their learning needs. So unlike others who took a sort of a synthesis approach, we did it, we sort of had a different, we went in a different direction, which was that we decided to take a developmental evaluation approach. And by doing so, we really acknowledged complexity. We acknowledged, we adopted a systems approach. We did not start with a log frame or any assumed clear results definitions. We really wanted to assess and evaluate adaptation while it was happening. And the key was really to try to understand the narrative of the way in which WFP had responded. How did it pivot? How did it react, modify, innovate, or in some ways get stuck even? We were certainly looking at where areas where they may not have moved, where they were immobilized or rendered sort of stuck in their process, let's say. So we really were looking, building actually on an evaluation that we had done a few years ago, a few years prior, on the capacity for WFP to respond to emergencies. We really took that evidence as our starting point, because in fact, some of our colleagues in our emergencies division said, we haven't even had time to respond to the recommendations from that evaluation. You're coming at us again. And we said, listen, we understand this. We want to try to provide evidence to the organization that's useful throughout the data collection phase, in fact, and not wait until the end, until the reporting phase of the evaluation. So we were looking at three main aspects. Look, how well did the enabling environment and organizational assets of WFP adapt to respond to the demands of the crisis? How well did WFP fulfill its role as a partner in the collective humanitarian response? And very difficult to answer was what in fact was achieved. So we did, to the extent we could, we did try to look at results assessing corporate and country related data. This proved very difficult, very, very difficult to do for a whole range of reasons related to sort of data validity and credibility. So what we did is we ended up, thank you, we ended up having an analytical sort of framework which identified 10 themes. And these themes really covered the full organization. And for each of those themes, we produced an evidence summary. So we had a team leader, but we had evidence summary leads, at least 2 people, including also researchers, producing 20-page papers on each of these topics that were then shared with the organization, particularly the key stakeholders relevant to that topic, be it workforce management, finance, risk, program adaptation. That's why the Mentimeter was hard. It's like, yes, 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 no to vaccine, no to health, but sort of on the procurement side. But it was really a whole of organization assessment with the organization as the evaluand. And there was just a high degree of consultation and collaboration and feedback throughout from sort of February until June of this year. We are now finalizing the report. And I can get into more of the details on that as we go, but really taking that developmental approach of looking at adaptation. And so I can share some of our thoughts collectively, because I worked very much in tandem in a partnership approach with the team leader. This was really a I was the manager from inside, but we worked very much collaboratively. So I'll stop there and happy to engage more as we get into the discussion. Thanks.
Thank you, Deborah, and thanks to everyone. It's really interesting to hear about the variety of approaches and the different implementing contexts and how each agency is adapted to them. So I think we'll get into a little more meat in the panel discussion on that, but it's really helpful to have the stage set for that and understand the main areas of work that you're all engaged in. So I'm going to now turn it over to Jane, who will be moderating this panel discussion. I would like to encourage participants, if you have any questions or comments, please do leave them in the chat box. And just also to remind you that there will be opportunity for a live Q&A after the initial panel discussion. So we really look forward to hearing your inputs. So Jane, over to you. Thank you.
Thank you very much, Mona, and thank you very much, colleagues. I agree with Mona that these are very rich discussions and also very rich evaluative exercises that the different agencies have undertaken. And what is interesting and what is core is that all of us have been very vested to ensure that evaluations still continue and that evaluations can support our agencies to ensure that we are delivering better as per our mandate. So this is certainly something that I'm taking away from all these discussions. And thank you very much for all these different providing all this feedback and also the providing the background information on all these different pieces of work that you have undertaken. So for this next session and for the evaluative activities that our panelists have described, we'd like to hear from them a bit more. Some of them have already alluded to some of these issues that we are going to discuss, but we'd want to hear from them what worked well in the conduct of these evaluative exercises. We want also to hear the challenges they encountered, and then also get a better sense in terms of how these evaluative exercises have been used, to change programming, also to enhance the work that we've been undertaking in response to COVID. So I'll start with you, Peter. In terms of the synthesis, especially because that has already been completed, if you could let us know what in your view worked well and what you are likely going to replicate in future evaluations, including those very much related to COVID. Over to you, Peter.
Thank you, Jane. That's quite a tall order. So let me try just to say a few things, and let me first say that in terms of what worked well or what is working well is, as I was trying to get across my presentation, is the coherent approach, the evolving approach, where we right from the beginning said, in these circumstances where we need to carry out evaluations and we have to get ready to have the evaluation of the COVID-19 response. What is it that we need to do? What are the steps we need to take? The guidelines on how to do the evaluations under COVID, the protocol to get evaluation information on COVID into the evaluations, and developing the framework. That is working well. I mean, there are challenges, of course, with having the ability to actually get this information and these evaluation questions on COVID addressed in a particular context, because monitoring information might not be available. There's also, in terms of the focus of stakeholders, of our constituents and so on, that they are focused on often dealing with the COVID-19 response, and therefore are not always able to think about, yes, but what does it mean in terms of that project that we had, that repurposed project that we had. So there are a number of challenges that, but what is working well is to have that approach and have those protocol, because it enables us to do the synthesis review. It enabled us to have evaluations that actually did say something about COVID-19, although not as much as we could have expected. And it's a bit what Richard was talking about, that you have sort of stages or generations of evaluations, if you like, that the first ones that get completed under the COVID are not necessarily that full of information on the COVID-19 response. And it's first later that it starts coming into evaluation. So the evaluations that we are now seeing completed and that will be completed over the next 3 or 4 months are the ones who will probably have more information. So in terms of the challenge in the synthesis review, particularly of an issue that often was not explicitly designed into many of the projects or is a result of the repurposing and the adaptation, is to actually be able to find evaluations with the kind of information that you're looking for in a synthesis review. And so also in terms of what worked well, it's again that staged approach that we are taking in the synthesis review. And we've now gone through basically the 2 stages where we have looked at the evaluations that have been completed up to now, and they are beginning to have more COVID-19 related information, but it's very clear that there will be more in the next 3 months. So the need to almost do the synthesis review on a rolling basis is important. In terms of the use, I mean, very interesting point that Deborah made about developmental evaluation and adaptation and innovation and focusing on that. Because we had in ILO that initial policy framework with the 4 pillars, we then had our masters, our constituents, our in the International Labour Conference saying, this is what we see is ILO's response to COVID-19, both in terms of immediate reaction, but also more importantly, in terms of recovery and in terms of building back better, et cetera, et cetera. And therefore, we need to take that into account as our lock frame, as our policy framework. Obviously, when we look at those elements, we will be looking at the innovation, the adaptation, and issues like the enabling environment and so on. But the expectations, and this is part of the use that we're not yet seeing in a sense evidence of, but we are setting it up and we are creating a reference group of senior level colleagues to be part of that evaluation, if you like, to be our sounding board and to help with the scoping and the utility and so on. It's because we really need to make sure that we meet the expectations of the constituents in terms of what we are looking at and bring back information to them that they can then say, okay, we think that framework that we put forward, the constituents put forward, the call for action and so on, is the one. We need to adjust it in this way, and we need to tell the organization, the office, adjust these things and so on. So we are very much, in a sense, tied into that, which is all about the use, because that's what our constituents, our clients are wanting from us. So sorry for having taken a bit more time in replying to that, but it was quite a lot of questions that you asked. Thank you.
No, thank you very much. Yeah, thank you very much, Peter, and very useful, especially this component of having a coherent approach and protocols to guide the entire process. I will move now to Richard. Richard, you also undertook a synthesis, and the same question: what worked well, and what do you see replicating in future evaluations, including those related to COVID?
I mean, I guess with our synthesis, we built up an experience already in 2020 where we'd look back at all the evaluations that UNDP had done and captured lessons from previous crises, such as Ebola and Haiyan and things like that. So we had a very clear approach on the synthesis itself. I think one of the challenges we faced was both as Peter said, going back, and as Peter said, in 2020, we spent a lot of time on guidance and a lot of time on making sure that people felt comfortable in implementing evaluations, different approaches, given the crisis and so on. So this also strengthened the evaluations that were coming through. But one of the issues that we're going to see is, as I said, in the synthesis, we found a lot of things. But what is lacking is a depth of data. People, though we were asking through 2020, collect data, impact data, really it's very difficult to see that. And one problem there is, it's not a problem, it's an understandable response to the crisis, that the majority of the early response was around procurement of health equipment. And it was based on a very clear and identified need to support governments in getting masks, PPE, and ventilators, and impact data was obviously secondary. So it's very difficult to see how those. I mean, we're looking in the first year, 2020, the majority, 76% of new and repurposed funds went towards procurement and support of the crisis. So, it's a big chunk of money, but with very little data behind it. And one of the problems there is UNDP, I think, it linked its data collection to that broader UN framework of data collection that we all know, which in itself was very high level. It was about numbers of people that were being supported, and was much less about impact at the country office level. So this is going to be a challenge going forward as we look at, what have actually been the results of the impact of the response to COVID-19. So the response itself and the synthesis worked very well, but going forward, getting much more nuanced data is going to be challenging. Thanks, Jen.
Thank you very much, Peter. Esther, in your case, what do you see having worked very well, and what can you replicate in regards to the real-time assessment that you undertook?
So several things worked well, definitely having guidelines and templates. So for us, we went to 7 countries. And because it was real time, we needed to roll this thing out real quickly. So having some standard tools that we tweaked and contextualized made it easier, rather than developing a separate set of tools and key format guides for each country. So that made it easy. Then the other thing that worked well is using a mixed methods approach. We mixed scheme format interviews, a perception survey that went out by SurveyMonkey, and desk reviews. So mixing that ensured that we got a larger number of people. As you all recall, at that time, governments in South Asia were busy responding. So for those we could not reach with a key format interview, we used SurveyMonkey. And it took a while sometimes, but at least they were able to respond. And then the variety of respondents. So we were able to get a good picture, from UNICEF staff, from government officials, from implementing partners, from frontline workers. And I think what was interesting is that sometimes there were differences in perceptions, which is really what we wanted to capture. Sometimes UNICEF felt something different, while the government officials felt different. So having a variety of respondents was good. Coordination with the country offices. The regional office was the one implementing this, but of course, you know, we needed the country offices to help us schedule those key informant interviews, sometimes nudging the government officials. So that coordination, you know, sometimes they got us interpreters. We had people who could not speak English, and yet our consultants, two of them were English speaking, so we had to get interpreters, and the country offices did that. So that worked well. And then flexibility. When we first began, we were under, you know, we assumed that the response plans would stay for some time. Lo and behold, country offices, you know, as the pandemic was changing, the response was changing, and sometimes the response plans were abandoned, you know. So, you know, we went in thinking we are going to evaluate based on these response plans. And then we were told, well, those response plans were at April and May, and as the pandemic kept changing, the response changed. So we had to be flexible so that we really evaluate the response rather than evaluating the response plan. So flexibility worked very well. So, you know, having guidelines in terms of what we'll do again, having guidelines, having good consultants. You know, it was hard to find good ones. We eventually did find some good ones. Having good consultants and being flexible, knowing that it's an emergency. And of course, mixing methods would be the things that I would repeat again. Over to you, Jen.
Thank you very much, Esther. Leslie, you also had a real-time review for West Bank and Gaza. What worked well, and what would you replicate in future evaluations?
Yeah, I think one of the most positive things about the work that we did was that we got an original request from the field, so there was you know, a big appetite to give us the opportunity to observe what was happening in the moment. We were shared, you know, information was shared with us broadly, emails that were going back and forth that illustrated what was going well, how things were being adapted, and what the challenges were. So there was just sort of this outpouring of more information than we could use. I mean, primarily we were conducting interviews to support our research, but we were also doing desk research to understand, you know, how things were being adapted. So fields were very open to sharing and allowing us the opportunity to explore, and staff were generally also very, you know, excited to talk about the challenges, and because it was a situation that none of us were really prepared for. So people were very open to wanting to share about their experience. I think that what's been, you know, this situation allowed us to kind of study the agency's, the adaptability of the agency's emergency management framework. So part of what we were trying to do was understand, you know, how did the agency respond to this basic emergency, and how did the frameworks for emergency management, how were they adaptable in this situation? And there was a lot of good feedback on this, and a lot of good sort of feeling about the value of the process. And so our team was actually approached not in May of this year to do a real-time assessment of how the agency responded to the recent hostilities, or the May hostilities in Gaza. So I think that's a really good indicator of the fact that, you know, this is appreciated. And I do feel like this has made sort of a significant influence on the culture for learning and evaluation in the agency, that people appreciated being a part of a process to influence understanding about how things were going, and to actually see that make a difference in the moment. So I do think that that's probably one of the most positive outcomes of the entire project. Thank you.
Thank you very much. And yeah, certainly very useful reflections, including the culture of learning, the demand side of our colleagues requesting for these kind of exercises, because they do feel they can support to help them do better in terms of implementation. That is very useful. Thank you. Deborah, over to you. You did allude that that not only were you the manager for the WFP's evaluation, but you are also working very closely with the team. So in regards to that, what can you tell us were some of the learning and also what worked well as part of that process? Over to you, Deborah.
Thank you. Thanks, Jane. It's interesting to think about what worked well, and I think I need to also sort of bring in the challenges, because in fact, when you overcome a challenge, it turns into something that ultimately worked well. But you start from a more difficult sort of spot. And noting also some of the questions that have come up, just what I noted Oscar's question, we didn't necessarily adapt to particular things as such, but we certainly, our analytical framework had to adapt and evolve based on the inputs that we were getting from our colleagues that we were engaging with throughout the process. So there was a high degree of sort of an iterative nature and feedback loops within our data collection process. So we didn't collect and then debrief. We collected and fed back in across these 10 evidence summaries throughout our data collection phase over about 6 months. And also someone else asked about mapping. This was something that I think was, a lot of work to map out key stakeholders, both internally and then on the partnership side. But once we had mapped them out, they became interviewees, key informants, and they became members of a consultative group. And we had a principle going in that we only interviewed people one time across these 10 evidence summaries. We had to map very carefully who we would go to for what topics, because you have a director of emergencies, she could speak to any number of the areas. But we really had this principle of minimizing the burden. So we did a very detailed stakeholder mapping, which I think helped facilitate uptake and also avoided pushback because we were very comprehensive, but we took an approach of really only touching like one interview per country office, one interview per person. So we really, because we had a very crowded and busy space that as many of us did. The other thing that worked really well, I think that is important to mention, in addition to sort of this adaptability, was being the comprehensive engagement gave us a window into people's work and allowed us to build up a certain level of trust within, colleagues that we were working with, which was crucial, particularly because in our first of these 10 evidence summaries, we focused on workforce management. And we were in fact interviewing, the team it was a pilot. We were conducting interviews in December and January. And in fact, finding that our colleagues were really, truly traumatized. In fact, they were needing these interviews to, in fact, debrief, and they often went on longer. And what our evaluation team had to do was, in fact, bring in a trainer to be trained in trauma-informed interviewing, which for humanitarian evaluations, usually you have that experience when you're face-to-face, you have specific skills and tools that you use to handle trauma in your face-to-face interviews. Doing that online was hugely challenging and very delicate, and that challenge was met and I think overcome. And it's something that did work well, because it was responsive to the specificities of the particular context and time. I think the fact that we had Michael Patton as an advisor was something that we can't underestimate. As we were sort of, UNFPA had done developmental, we were maybe the second that had done it on this corporate scale, and having his advice and guidance was to us as a full team, as well as to the evaluation team, was really useful, as well as the leadership from our director. So I will stop there because I know you have more questions to ask. Thanks.
Yeah, no, but also, very useful also to hear about the use of the analytical framework, the feedback loop, and how mapping of the stakeholders and engaging them systematically helped in regards to this evaluation. And of course, it does not hurt when you have Michael Quinn Patton as part of an evaluation team. I didn't even know that he's usually part of teams nowadays. So that definitely was a bonus.
He was just an advisor. He wasn't really part of the team. Let's just be clear.
Yeah, he was an advisor. Yeah. Okay. All right. Thank you very much. So, so we'll move to the final set of questions. Again, you have alluded to many of these, but we really just want to know, how were the findings disseminated, and what do you have as evidence of uptake and use? Peter, You have alluded to how the synthesis was used, but do you have any further reflections?
Thank you. We know that the guidelines on the adaptation of evaluation has been used. It's part of why we've been able to continue with a fairly high level of our required mandatory evaluations. The protocol has also been used, not as much as we would have liked, but we see it as part of the reason why we have evaluative information that we can look at in the synthesis review. As for the synthesis review, we have just completed, as such, the bulk of the synthesis review and released it as a report. And we will then work on how we can help colleagues in making use of this. A very key use of it is going to be as the basis for the high-level evaluation, where we, if you like, will put it all together. Synthesis reviews are a normal standard practice of the high-level corporate evaluations that ILO is doing. So there's nothing new in terms of the methodology. And one of the main uses of it is for the high-level evaluations, but they're also used separately. And we have other synthesis reviews that we do as part of ongoing discussions in our governing body and our conference. So the synthesis reviews will definitely be used for the evaluation, and they're already forming the scoping and the specific evaluation framework that we are going to be using. And as I mentioned earlier on, that key for the use is that we deal with the demand. And in the case of ILO, the demand is, as I mentioned, the labor conference, the constituents, having said we have this policy document, this call for action, where we see that ILO's work on COVID-19, on responding to COVID-19 and going forward needs to be this, and this. So how are we doing with that, both in a summative and particularly in a formative way? So that's the question that we will answer. And when we do that and we present it to the governing body with office response and with involvement of the senior management and so on, this reference group I mentioned, we are confident that there will be use. But in that sense, we don't yet have an uptake of the evaluation because we haven't yet finished it. The synthesis review is also just up there. While I have the floor, because I saw a very interesting question in the chat box from my old colleague Guksa, and this is about how the building back better, how COVID-19 response is going to be with us, or the pandemic is going to be with us. So we will have to respond to that. In ILO, this is very much part of the formative looking approach, and where we are saying, yes, what we're dealing with is changing in the world of work as a result of the pandemic. Some of these changes were already happening. They have been exaggerated and accelerated by the COVID-19 response, but they are part of how the world of work is changing. And therefore, our evaluations in the future will, of course, have to be able to look at that and see how, first of all, the world of work is changing. And secondly, that we continue to sort of look at how external shocks, which in a sense the COVID-19 is, how that affects the organization's ability to adjust and to be able to continue its work. So that was a very useful point, and one I think we really all need to reflect on. Thank you.
Thank you very much. Richard, any additional points in terms of how useful the synthesis was, and also the evidence you have in regards to its uptake and use?
So we launched very much in partnership with UNDP, colleagues in August. And we built an online discussion. We have a Spark Blue platform, which is a thematic discussion board platform. So we did a lot of work around that with them to get them, to get colleagues who were involved in the planning and strategizing around COVID-19, to really get them involved and understand the things we have found. Of course, that was in August. So it's not such a long time ago. we're hoping that those lessons will find their way into programs, and we will be measuring that through future evaluations, as was pointed out. Then it's also very much informed the evaluation that we're doing now on SDG regression, which how UNDP is addressing SDG regression through SDG financing. And I think that very much goes to Gugsa's sort of message that, our evaluations, our ICPEs especially, will for some time have a COVID-19 section. We're going to be looking at response, adaptability, and the changing world due to SDG regression, the need for financing, which is now being diverted to COVID response. That's going to be very much part of our own evaluations going forward as well.
Thank you very much. Esther?
In terms of dissemination, we produced a regional report, a country report. Each country got a report, and also the findings from South Asia fed into a global synthesis report. Hopefully, that enabled larger learning. Now, the mandate for us was to present to the regional management team. So UNICEF has a regional management team and a meeting twice a year. And so we had to actually make sure these findings were ready. And I believe that meeting was in November. So after presenting, there was a discussion on the implications of this. Now, subsequently, ever since last year, we've had a monthly meeting with all the representatives. This is a regional COVID meeting. So in the first part, first 6 months, there was reference to the findings. Now, the findings have become stale and new issues have come up. But I think what we can say is, we could hear some of the themes and some of our findings as the representatives were discussing. In terms, somebody asked a question about mainstreaming COVID response evaluations. And this might be similar for other organizations. All our evaluations now, COVID is the big thing happening. In our country program evaluations, we have asked, how did COVID impact the country program document? Country program. In other evaluations, you have to put in COVID as one of the factors, and how have you adjusted? So I think that's the mainstreaming that we have to do, and we are doing. And then also, when you look at our humanitarian development nexus, we are looking at how people and how country offices have actually used the experiences from COVID for their humanitarian, their development work. So I think those are some of the ways we can mainstream. Over to you.
All right. Thank you very much, Esther. Leslie, you have explained a bit in terms of how the findings were used. How else, how can you, what evidence do you have in terms of actual utilization of the synthesis, of the real-time review?
Well, this is a good question for us because this is a big lesson learned for me. So we developed the terms of reference again, within like a week's time. We were sharing it, and this was all supposed to happen very quickly. And we did share information very broadly through multiple forums that included senior managers and at the agency level as well as the field level. And then we have an interagency evaluation interest group, and we presented information there, which included that group includes all the field M&E leads. Okay, and so I think there was a lot of learning and sharing of experience. However, in our TOR, there wasn't a requirement for a management response. There wasn't a plan for how this was going to be tracked over time. So it was definitely something that I learned, and again, I'm even learning that again with this. It was honestly like an after action review that we completed on the agency's management of the emergency response in Gaza. I think having clear information in the terms of reference about reporting, how reporting will be shared, and and how it's disseminated, as well as requirements for management response and tracking. I mean, it wasn't really, I mean, because of the design and the nature of the study, it was really meant to influence change in the moment and understanding about how things were adapted, and to, you know, sort of shed light on staff perspectives of the challenges, so for immediate use. And I think that happened, but I didn't go back because of our capacity to track and see how that influenced change. So, you know, that's a big lesson learned.
All right. Thank you very much. Deborah, over to you.
Okay.
You had stakeholders engagement and feedback, and the evaluation is just getting completed. So imagine you are going to have a management response at some point, but can you also tell us how you see the findings being disseminated, and also how the evidence that has already been gathered is being taken up and being used?
Yeah, no, it's an excellent question, and I'll maybe just also give a plug for an EPE session that on use and measuring use, and can we prove our worth? We're holding it next December 14th from 4 to 5:30 Eastern Europe time, CET. But no, it's not. I think we have to go beyond saying we have a report and therefore there's going to be use. And I know no one's saying that. It's not that simple. But we did produce these 10 evidence summaries. So these were things that not only got produced, but got discussed and presented and debated with colleagues who were specifically, you know, specific stakeholders that were, you know, working in that area. And we have 2-page briefs from those. So we have those sort of, you know, 10 topics, longer 20-page papers and 2-page briefs. So those were produced and shared in real time throughout the data collection phase. We, of course, have our full report and our summary report, which is going to the board, so those standard documents. But we had, and I mean, sort of, it's hard to measure it quantitatively, but the feedback during these consultative group sessions, we had, for example, the emergencies division working on developing new protocols. They had their own lesson learned process from the response, or, you know, from the early stage of the response, let's say. And they were actively saying, this is contributing to our thinking. This is going to be very useful for us. We're going to use this element of this, you know, this evidence to help strengthen this particular area of, or this is changing our thinking, you know, these kinds of feedbacks or pushbacks saying, well, this doesn't, you know, coincide with our view of things. So, you know, the sort of richness of engagement with colleagues on some of these topics. We also just recently, in fact, in the last couple of weeks, gave high-level feedback to colleagues. So basically looking at the summary report, we had 6 regional meetings with our regional bureau colleagues and all of our country sort of senior management from the countries in those regions. So we tried to not only provide the high-level findings, but provide examples from those regions to those colleagues. And we did the same thing at headquarters. So really a much more kind of closer engagement of feedback at the higher level than what we would perhaps normally do. And certainly got more people than if we were in person. The remote modality, I think, facilitates that. Last couple of points were that we were asked to, or we actually made it happen. We spoke to our global operational task force. That's all our regional directors at an earlier stage. We sort of tested and validated with them. We were invited to a senior staff retreat of our emergencies division. So different ways we've been asked to come and share evidence. You mentioned, Jane, in your intro, management response. So yes and no is sort of how we're approaching this. So our evaluation does not have recommendations. It has issues for consideration. So because it was a developmental approach and we were very much looking to track the way that the organization adapted and developed, we weren't looking at improvement. We weren't looking, and it's, you know, the issues that have come up are very much deep systemic strategic issues. So, but we do have a system that tracks evaluation recommendations and responses that we don't want to lose that opportunity for some accountability. So what we're doing is, in fact, we haven't completely confirmed it, but we're proposing a 2-staged approach. One is that in February, when the summary evaluation report goes to the board, that management will provide a narrative response to the evaluation. That will not be a management response in the sense of tables and you know, going into a dashboard, but it will provide a response. And then we will give them, in a sense, 6 months to reflect further, or 5 months, let's say, and then provide a more detailed management response to the 6 issues for consideration at our June executive board. So we're trying to keep it at a high level, and really, because it's so broad and organization-wide, we really want to sort of catalyze that kind of strategic discussion at the highest level, rather than having things get sort of delegated to a particular division, as often is the case. So I'll stop there. Thanks.
All right. No, thank you very much, Deborah. And thank you, Peter, Richard, Esther, Leslie, for sharing your insights and your experiences in undertaking these evaluations. Lots of commonality. And I think as evaluation functions, we've wanted to ensure that we are supporting our organizations and providing evidence for them for learning. So these discussions have been useful. Back to you, Mona. I know we have a lot of questions, and it will be great to just start looking at them. Over to you.
Thank you, Jane, and thanks again to our panelists. I think it's really exciting actually to hear about all of the different approaches and adaptations made. I think this sort of global, soon becoming a protracted crisis has really shaken the foundations of how we do our work and how we communicate these lessons to decision makers. So I think there's a lot that can be taken forward, even in non-COVID evaluation work. So we have a lot of interest and engagement and great questions coming through in the chat. So I'm going to turn it over to Carlotta to address those. At the same time, if you do have any questions and you'd like to speak up, please do use the raise hand function, and we will call on you if you have any questions or comments for our panelists. So Carlotta, over to you.
Thanks, Mona. Thanks, colleagues. Again, thanks for the interesting discussion and for the questions that have come in. I think it would be good for me to recap the questions that have come in through the chat box. Panelists have addressed several of these aspects, but I would say I recap them now, and then I'll leave it to panelists to see which of these questions they would like to address further and follow up on. So, we have a question from Oscar. To what extent did you consider the changing enabling environment, UN response, while conducting your evaluations? A question from Vijay. Did you look at the extent of the UN working together at new ways of working on the ground in your evaluations? We have a question from Susanne, who says she's always interested in learning how to improve utility and use of evaluations by senior management and decision makers. And she would like to know from the panelists, what lessons do you have on what was considered by senior managers from these evaluations? For example, through the rapid evaluation approach and the focus on country experiences, etc. We have a question from okay, maybe we can start taking these, okay, and then I'll move on to the next ones. We have some others as well. Back to the panelists, whoever wants to respond and further address these. Over.
Hi. Can I come in with one of these?
Sure, please go ahead, Esther.
Okay, so we looked at the extent to which the UN agencies in country were collaborating. And I think earlier on, at least by last year, you know, because we're looking at the response up until August. And in many countries, that coordination was a problem. And I think several respondents said, you know, sometimes the arrangements and agreements were made at HQ level, but then, you know, sometimes that didn't translate to what was happening in country. So there's this global agreement that, you know, these agencies, you know, we are supposed to work together on this, but it did not necessarily translate. So everybody was trying to figure out, you know, how does this agreement get implemented? So, you know, especially in procurement and other things. So the coordination was a challenge. Now, all UN agencies were supposed to be planning with government, but when it actually came to delivering and coordinating and implementing some global agreements, overall we found that was more chaotic earlier on in the response than would have been desired. Back to you.
Thank you, Esther. I see there's Peter has his hands up. Peter, over to you.
Thank you. Yes, it's also on the point of the UN context, and yes, that was very much part of the ILO's, for instance, its 4-pillar policy framework, how it related to, for instance, the social economic response, framework, and other UN and framework. So it's very much part of the response, the lock frame that we are looking at, and then therefore also very much part of our evaluation framework. It was one of the dimensions in the synthesis, the review, the link to the UN context. There's of course also, when we look at ILO's work, for instance, and I'm sure that applies for others, that we work at many different levels, and one level is the policy level. And one of the responses of the ILO was to issue a number of policy briefs, as well as what we call the ILO monitor, that actually provided a lot of the statistics and information on what is happening to the world of work, what is happening to employment, the situation of women, etc. In the world of work, that was then used in many different contexts, and even was part of informing UN frameworks. The SG's report, for instance, that included social protection, that was based on a lot of research from ILO. And of course, in our evaluation, we will very much make use of any relevant evaluation that covers issues of interest within our evaluations done by other agencies. And of course, there is the UN cooperation framework evaluations that are ongoing, where UNEG and with EVAL and others involved, came up with guidelines on the evaluation of UNCF in general, but also then tried to include COVID-19 responses. And then I saw also in the chat there was a reference to the upcoming system-wide evaluation of the UN development systems response to COVID-19, and that will have also case studies in countries, and there again the link with what we're doing, if it's the same countries, and I'm sure that will be for other agencies, if it's the same countries we are looking at, we will be making that link. And just on a remark on that, there is going to be a synthesis review of the synthesis reviews and evaluations of done by the UNEG agencies as part of that system-wide evaluation. That will be using the synthesis reviews that we have done in ILO, in UNDP, and others as part of the evaluative information that will be looking at. So that, in a sense, is the link. But that, of course, has its specific purpose, its specific focus, and all of us in our agencies have additional focuses and so on. But I'm sure we can all say that we will consider the UN system response as the way that we are part of it is, of course, part of all our evaluations. Thank you.
Thank you, Peter. Any other panelists who would like to add on to these questions before I ask the following ones? I see.
I mean, maybe just very briefly, Carlotta. I mean, we also, and I'm very aware that those two questions came from UNDP's evaluation unit, so I do feel a bit sort of responding to the director's question, but it was slightly unavoidable given that the UN set an early framework and UNDP very much aligned with that framework. And then the two key sort of coordination tools being the socio-economic impact assessments, which was sort of managed by UNDP in coordination with the UNCT, but then the SERP. So we have looked at it, and we've done case studies for the current evaluation that have sort of looked at that relationship. But it's a difficult one to sort of, it often comes down to relationships as much as coordination mechanisms. So we've looked at it. How in depth we've gone is a different question, because it does take you into an area that maybe, and there's a need to look at that coordination, I think. But as an individual unit, we've looked at UNDP's alignment and cooperation, but not at the broader alignment and cooperation.
Mm-hmm. Carlotta, I also can come in, if I may, on the
Sure,
one about the lessons on what was considered by senior managers. I think one of the things that we took away is in some cases it validated things that senior managers were thinking. I'll give you an example. We had a component on duty of care, and you know, senior managers knew some of the issues, but I think bringing them out and saying that, okay, staff, even consultants are saying this and the other, actually brought it to the forefront. And then in some other cases, there were surprises because in some countries, there was the perception that monitoring, on-site monitoring was happening by third parties, and then it wasn't being done as well. So it validated, it brought out information, and so that helped. The other issue was that I think they realized that there was more commonality across countries. You know, there were some bottlenecks in procurement that each country was facing, and some of these were regulations and, you know, procurement guidelines that, you know, everybody was dealing with, you know, one-on-one, you know, between themselves and, you know. And then when we released this report, they realized that there were actually things that were in common. So therefore, the RD went about talking about how do we actually remove these bottlenecks in an easy way. So I think I'll give those two as examples of how we use this and how decision makers used it.
Thank you, colleagues. I think time is running, so let me recap the last set of questions that have come in through the chat box. And again, I'll leave it to the panelists to decide what to further address. The question from Nicholas would be great to hear more about how the evaluation teams have identified decision makers and users for their rapid assessments and syntheses. The question from Guksa on the fact that COVID is here to stay. The new normal, I think, is to live with it. COVID is becoming endemic. I think we need to move to mainstream COVID response evaluation like other cross-cutting issues rather than taking it as a separate issue. Is it too early to think and start working in this direction? Any comment on this? And then the final question that have come in from Sabas, how do these useful learnings feed into the evaluation of the UN system response to COVID-19? Over to you.
Carlotta, sorry, if I could just come in briefly on the system-wide evaluation. I know Peter has already addressed it. So just to note that, as he mentioned, it would be starting with a synthesis component, and I think that was something that the system-wide evaluation team had decided to incorporate after feedback from other UNEG members, and you know, looking at mapping the existing very extensive evaluative work happening amongst UN agencies. So that is meant to be the first stage and meant to be ready by spring, and then the following stage will come after that. So I'll turn it over to the panelists on the other questions.
I see Deborah's hand is up. Please, Deborah.
Thank you. Thanks very much. I just wanted to come in on Nicholas's question. And it's just in thinking about how the question's framed, you could sort of look at it in different ways, because decision makers, you know, and users, I think the way I'd like to answer it is that we started off by talking to senior leaders. Our director, in fact, took this sort of up at the senior level to ask about what the key issues were. What were the learning needs of the organization in the response to the pandemic as it was still going on? So that was, you know, sort of the first level of identifying key users and the key decision makers who would be benefiting from this evidence. We then, you know, once we had defined our analytical framework and defined these 10 evidence summary topics, we then had to map out key stakeholders and, in a sense, users and decision makers within each of those areas, because those are people who are both key informants for us, but also people we wanted to have uptake, you know, evidence at the central level, but also be engaged at the regional and country levels. So we, as I mentioned in one of my previous responses, we were very, very careful not to burden. So we really did of the 10 evidence summaries that we had, only 5 of them had a country interview component, and we did that very purposefully. So we sort of wrote to our regional directors and said, in your region, these are the the topics of the evidence summaries that we would like to cover. These are the countries that we'd like to cover, and so in your region, each country will only have the one interview, and depending on what the topic was, that was, you know, the lead on emergency preparedness and response, or the HR manager is the person we would interview. So those people then became key users of the evidence at the end, because we engaged them again whenever we were, you know, presenting and feeding back the evidence from that particular summary. All the people that were interviewed for that summary were then brought back in to hear what we had to say, and then also brought back in when we fed back on the broader, you know, the broader findings. So, you know, and again, we're using different, as I mentioned, I think in my last answer around dissemination, targeting different groups of people at different times to either validate or to then disseminate in a way and encourage use by presenting evidence to them. So I don't know, that's sort of a multifaceted way to answer, but that's essentially how we approached it. Over.
Great, thank you, Deborah. Peter, is your hand up from? Yeah.
Okay. Yeah, sorry, just a quick follow-up to sort of what Deborah was saying about the decision makers, and that's basically asking the question, I'm not quite sure why the process of identifying decision makers and users is different for the COVID-19 in terms of the process. Of course, when you get to the specifics, you identify key informants and so on, and key stakeholders, you get it differently. But this is about evaluating an organization's response to COVID-19 as it is integrated or is throughout the whole organization. It's part and parcel of our work as we go forward, building back better, part and parcel of our work on how we deal with this and so on. We have, I mean, in ILO, there are established ways of identifying the decision makers, the users, the respondents and so on in any given evaluation at the different levels from project up to high level evaluations. And that's the process to follow, because that's also linked to how the organization is going to respond through its program, its budget, its organizational, you know, structure, and so on. So I think, you know, it's useful to look at it in that way, that we have to mainstream, we have to integrate the COVID-19 response, the evaluation of it, into our processes that we are used to. Of course, we can learn from the process of doing the evaluations under these specific conditions to, you know, adjust and adapt and modify our approaches and so on, and even our program structures. But, you know, it's part of that. So that's how you also ensure use and follow up. Thank you.
Thank you. I don't see hands up. I think we're running out of time. Mona, I think I'll pass it over to you, back to you.
Thank you, Carlotta, and thanks again to the panelists and all of the participants. Indeed, we are coming to the end of the session. A really interesting and rich exchange. I know I've taken away some ideas of aspects to incorporate into future evaluation, so I hope others have as well. So thank you again. This recording will be available on the UNEG website, so we do encourage you to share it with colleagues who were unable to attend today. And again, our thanks to the panelists for sharing their experiences, and to Jane and Carlotta for their roles in organizing and facilitating as well. I will also put in an additional plug for the next EPE that Deborah had mentioned on evaluation use, which is very much sort of emanating from our discussions today, and very much in line with that. So I think it will be, in a way, a good continuation of some of the issues we've already been discussing. So I wish everyone a good rest of your day or evening, and we look forward to seeing you in future EPEs.
Thanks a lot. Take care. Bye-bye.
Thank you. Bye.
Thank you.
Bye.
Bye-bye.
Bye.
Thank you.